My original topic of interest was assisted suicide, comparing the opinions people have on assisted suicide and their support for it. Comparison would be made between two groups: people who have terminal illnesses that would qualify them to use assisted suicide, and a sample of the general Canadian public. The topic was later adapted to focus more specifically on reasons that people have to support or not support assisted suicide. Through the qualitative interview portion of the research, the proposed questions would look at reasons people have to support their views either way. As well, an additional part to the research was added. I also wanted to look at reasons people have for choosing to use assisted suicide or not. The survey response would be asked not only why they supported assisted suicide or not, but if they felt that they would personally use the procedure in the future. Original null hypothesis was that there is no relationship between holding an opinion in support of assisted suicide, perceived future use of this medical procedure, and having a medical condition that would qualify for its use. Essentially, that no correlation would exist between having a terminal medical illness and supporting assisted suicide. The hypothesis did not experience much refinement, just some specification, where a list of some qualifying medical conditions was added, such as a terminal cancer diagnosis, HIV/AIDS, congestive heart failure, heart disease, liver disease, multiple sclerosis, and Parkinson's. 2 samples would need to be established and chosen for this research, one of patients with a terminal medical condition and one from the Canadian public. The London, Ontario area was chosen as sample from due to its large but still manageable size to ensure a representative sample. So the first population would be of the general Canadian public. So for this, probability sampling and more specifically systematic random sampling was used to mail 10,000 surveys to adults 18 plus in the City of London. Census data was used to initially establish the sampling frame, and from there random number generation used to narrow down the sample population. Adults had between a 1 in 25 and a 1 in 28 chance of being chosen for this survey. It was assumed that there would be a low response rate, which is why 10,000 surveys were mailed. All surveys for either group were the same and could be completed anonymously, as they were distributed with a paid return postage envelope. There was, however, an area to indicate interest in being contacted to participate in a further interview. Interested people could write down their contact information, and from there, random number generation was used again, in this case for both groups, to determine who would complete a qualitative interview. The second population, those with the qualifying medical illness. So it was determined that the sample of terminally ill patients would be harder to locate, therefore no sampling frame could be established, and it became necessary to conduct non-probability research. As well, there was little chance of overgeneralization in this case. Both convenience and snowball sampling were used. I distributed questionnaires to anyone I encountered with a terminal illness, and they referred other people to me. As well, specialists working with the identified illnesses were contacted and asked to distribute surveys to patients at their own discretion. For the quantitative portion of the study, only one survey was generated, where respondents from both groups were asked general control questions first, such as age, gender, marital status, children, education, and their perceived level of health. They were also asked to indicate if they had a terminal illness. From there, questions were asked about support for and use of assisted suicide. A second portion of the survey asked similar questions to the above, asking that respondents rank their answers. An example of this being a question such as, how supportive would you be of a friend using assisted suicide, where the answers ranked from not at all, slightly, uncertain, for the most part, to completely. For the qualitative portion, 2 questionnaires were used, one for the group that indicated a qualifying terminal illness and one for the group without. The questions for both groups were similar, centered on explaining their reasons for supporting or not supporting assisted suicide and using or not using assisted suicide in the future. The purpose of this segment of the study being attempting to understand the underlying factors that influence someone's decisions. The difference between the 2 questionnaires was that the group with a terminal illness was asked questions that focused on their illness and if it played a role in their decision making, essentially to determine if there was a difference between the 2 groups in this regard. It is assumed that a positive correlation will be found when survey respondents have a terminal illness qualifying them to use assisted suicide, and that the standard deviation of the group without such an illness will be too large to satisfy the 95% significance level. However, this will still be beneficial in showing the difference between the 2 groups. Anticipate that the group without a terminal illness will show very differing responses, with some people being very supportive of assisted suicide and willing to use it themselves, and others completely opposed. I also anticipate that the group with a terminal medical illness will be very supportive of assisted suicide, showing less diverse responses. Overall, I believe that the presence of a terminal illness will directly correlate with support for assisted suicide, and that this will be proven within the research.